Hey guys, I'm Ethan, your New York-based organization development coach, and I want to bring to you today a story that I don't believe is getting nearly enough press, or if it is, this information is not being disseminated to the general public in a way in which I feel is critically important. So I want to frame the situation for you. A few days ago, I was talking to a friend of mine who's a therapist, and I asked how business was going, and he said, to be honest, not going well. So I said, what's going on? And he said that there was a situation where the system that he uses to sign up new patients and to submit claims for insurance, the system went down. And I didn't register how critically important that was. And I said, so what are you talking about? And he said, well, it's the system that most healthcare organizations in this country use to get their processes submitted, to get their claims submitted. Excuse me, hospitals, healthcare providers, private physicians. And I thought, wow, that's impactful. And then a few days later, I was talking to another friend and I asked her how things are going. And she said, to be honest, not well. So I asked, well, what specifically are you dealing with? And she said, well, she is a doctor and she submits claims on behalf of her patients so that she can get paid and keep her practice going. She said the system went down. And I said, what do you mean the system went down? Now, two discrete events a few days apart. Now it's on my radar screen. And she said, well, there is this system that's responsible for a significant number of all of this country's health claims being processed. And the system was hacked, apparently, by this nefarious group. And they wanted to hold that system hostage until they were paid ransomware. And I said, well, okay, what is this called? And she said, well, the organization is called United Group Health. And they have a subsidiary called Change Healthcare. And that's the division of United Group Health that is responsible for processing all these claims. So I said, okay, let me take a look into this. And so this is what I want to talk about today. And so I'm going to share with you the Change Healthcare attack, explaining how it happened, because I knew nothing about this. And what really bothered me is I belong to a bunch of different business networking groups, and there are quite a few individuals in these groups who claim to be cyber professionals. They claim to provide cybersecurity on behalf of clients. And in the meetings that I've gone to, subsequent to finding out from these two separate individuals that this issue is going on, nobody mentioned it. So I said, this seems to be a story that needs to be told or a story that needs to be reported on. So I looked into it and I want to kind of share with you the Change Healthcare attack, explaining how it happened. So the Change Healthcare was hit with a ransomware attack by a group called Black Hat after its systems were disrupted. So I want to share with you some of the background on this. On February 21st, Change Healthcare publicly announced or disclosed that it was impacted by a cyber attack. So a group called Black Cat claimed responsibility for the attack, demanded money to return services back online. So this is obviously a ransomware attack, and it's kind of malware that a pretty evil organization, a group, would put into the data that exists in this case, Change Healthcare's victim systems, making that information inaccessible until the ransom's paid. So the impact of this Change Healthcare cyber attack has been devastating to the healthcare industry. And check this out, hundreds of millions of Americans who rely on the services provided by victimized providers. So again, did Change Healthcare handle this situation appropriately? Does it reflect well on this organization, its culture of response and caring and service and all this other stuff? It's probably way too soon in this process. I mean, this just happened February 21st. So we're going on what? 2 weeks into this process. Change Healthcare apparently paid the ransom, according to people who do security research. Although Change Healthcare hasn't publicly confirmed it has or it has not paid the ransom. There was a message posted on X, which is Twitter, said that they apparently Change Healthcare paid 22 million in ransom in 350 Bitcoins. that was paid on March 1st. So this happened February 21st, so a little over a week later. At the time of the writing, Change Healthcare services are expected to be completely restored by mid-March. And I don't necessarily know that I agree with that, because in what I've read so far, the jury is still out on the time frame for getting this massively important system to the United States healthcare, this online payment processing system, back up in full operation. So, Change Healthcare, never heard of it. And understand this, many, many years ago, when I worked in the private sector, I spent 20 years in corporate America doing marketing product management. I worked for an organization called Electronic Payments Network, or the Clearinghouse. And other than the Federal Reserve, they're the largest organization in the United States that's responsible for processing daily automated clearinghouse debit and credit transactions. So anytime you use a credit card and you do a debit or a credit transaction, I work for the organization that processed those. So I'm a little bit familiar with the power that goes in the United States economy, in the infrastructure of having all of those online payments processed in a timely fashion. So back again to this story. Change Healthcare is a healthcare technology company based in Nashville. Has locations all over the United States, UK, New Zealand, Israel, Taiwan. So it's massive, 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 massive. And it's a subsidiary of a parent corporation called UnitedHealth Group. Okay. So the Change Healthcare platform provides several different services to healthcare providers, including payment and revenue cycle management. It helps healthcare providers with claims processing and payments, as well as integrating a system for appeals management from claimants for denied claims. It's one of the largest health information exchange platforms in the United States. It manages 15 billion health-related claims a year. Total value over $1.5 trillion. So this is a big deal, a really big deal. And I'm sitting here going, well, wait a second. Why am I not hearing about this? What is being done to remedy the phenomenal impact that's being done to not just thousands or tens of thousands, but hundreds of thousands of individuals on both ends of the spectrum, from those who rely on the services being provided by these healthcare providers, and the healthcare providers having timely payment of claims submitted so that they can continue to stay in business. So, okay, what is our government, the United States Health and Human Services Department, doing or talking about with regard to this? So, took a little bit of looking around, and the HHS issued a statement regarding the cyber attack on Change Healthcare. Okay, so this is a few days ago, on March 5th. U.S. Department of Health and Human Services is aware that Change Healthcare, unit of UnitedHealth Group, was impacted by a cybersecurity incident back on February 21st. HHS recognizes the impact this attack has had on healthcare operations across the United States. HHS's first priority is to help coordinate efforts to avoid disruptions to care throughout the healthcare system. Too late. Too late. There's already been a significant adverse impact on health services in this country. So HHS is in regular contact with UnitedHealth Group, leadership, state partners, and numerous external stakeholders. Okay, fine. HHS issuing a PR statement to protect its reputation and to explain what it is doing. So to be fair, HHS announces that affected parties should be aware of the following flexibilities that are in place. In other words, initiatives that are being done to remedy the adverse impact, right? So Medicare providers needing to change clearinghouses. That's what Change Healthcare is. It's a clearinghouse. They process on a daily basis all of those insurance claims. They clear them, kind of like when I worked for the clearinghouse or electronic payments network. So Medicare providers needing to change clearinghouses that they use for claims processing during these outages should contact their Medicare administrative contractor. Okay, so here's the thing. Talking to a few people and doing a little bit of research, it's pretty apparent that doing this, changing your clearinghouses, is not as easy peasy as it would sound. It's an incredibly complex, timely, and involved process. Okay, great. So CMS will also issue guidance to Medicare Advantage organizations and sponsors, encouraging them to remove or relax prior authorization. I can't speak to whether this is being done. I'm not an expert in this, but so HHS, Health and Human Services, has issued these directives or this guidance on how to mitigate or reduce the adverse impact of this massively important clearinghouse being hacked. Okay, so what you should know about this, because again, I'm of the opinion in my little humble kind of silo of the world, I've spoken to several people now, and this story just doesn't seem to be getting the press. It's not getting the due attention it deserves, considering the massive impact to our economy and the United States healthcare system and to healthcare providers. So, what you should know about the United Health cyber attack. Patients who rely on this system need to watch their medical bills closely in the next few weeks. So again, started February 21st. We're sitting here on March 9th, and this is apparently still in effect and going to last in the near foreseeable future, at least in the next few weeks. Pay attention to your billing because there's obviously an impact. There's massive disruption until we are able to ascertain that this gets resolved. And we're talking about malware. We're talking about ransom. We're talking about an organization called Black Hat that went into a system of incredibly vital and secret and important patient information, and they hacked it. They infected this system. So there's a risk associated with your information, my information, which is ubiquitous. Our information, our healthcare information is out there everywhere, and it's at risk. And this information was hacked, it was stolen, it was infected. So what happened and when? Back on February 21st, hackers accessed an IT system within Change Healthcare, the subsidiary of United Health Group. United Health is based in Minnetonka. So the company had to suspend operations of its electronic data clearinghouse and all related systems within Change Healthcare's business model. This is massively important, not just to patients, not just to healthcare providers, but to this company called United Group Health and its subsidiary, Change Healthcare. What is going to happen as an impact of this? This is also a consideration. So these systems are used widely by pharmacies, hospitals, clinics, and solo practitioners, people like healthcare providers, therapists, for example. The change processed and estimated this Change Healthcare processed an estimated 50% of all U.S. medical claims in recent years. Half of all claims. So this is massively important. So how are healthcare providers affected by this? Well, the two people that I spoke to who are friends of mine, who both provide mental health services to patients, for example, immediately after the hack back on February 21st, drugstores could not verify coverage of medications at a pharmacy counter, although United Health Group says these systems now have been fully restored. Hospitals and clinics have been unable to file claims for payment from insurance companies, raising worries about how are they going to be financially viable? How are they going to maintain their business model? Again, am I overstating the importance? I don't know enough about this other than to know that their very hospitals and clinics, their very real ability to submit claims and get reimbursed, their revenue base, their funding for their day in, day out operations is at risk. Do we know who did it and what their motive was? The company says, Change Healthcare, the company says cybercrime threat actors gain access to certain information technology systems at Change Healthcare, and the actor representative itself is Black Cat. This group is notorious for encrypting data to hold it hostage in order to secure massive ransom via cryptocurrency. United Healthcare says all of the company's systems are operational. Wonderful. So, United Health Group now, the parent company, provides an update. So as of yesterday, United Health Group provides updates on response to Change Healthcare. Okay. In a statement today, Well, I want to go back for a second. United Health Group late yesterday announced a series of updates on its response to the unprecedented cyber attack against its subsidiary Change Healthcare. In the announcement, UHG outlines anticipated timelines for restoring Change Healthcare affected systems for pharmacy services, payments, medical claims. In addition, UHG provided new details about funding support for providers affected by the outage and said that for Medicare Advantage plans, it's temporarily suspending prior authorization for most outpatient services and utilization review from MA and patient admissions. Okay, so here's the thing. I'm not going to dive any deeper into this other than to extrapolate one observation. In risk management, in the field of business continuity, in the field of public relations, we know that an organization that is struggling with things like United Health Group is right now, there's no such thing as too much communication. The more communication, the better, especially when you clearly navigate the ship through the turbulent storms. Is United Health Group doing that? It's critically important that they maintain a constant line of communication with all of their stakeholders. And this is a step towards that. So I want to share something else with you. The Biden team and United Health struggled to restore paralyzed billing systems after the cyber attack. Going back 2 days, March 7th, in a March 7th statement, United Health Group said 2 services related to its electronic payments and medical claims would be restored later in the month. Okay, that's later in March. While we work to restore these systems, we strongly recommend our provider and payer clients use the applicable workarounds we have established. Issue is, and I didn't research this fully, but are there sufficient workarounds that are going to serve the needs right now, the vested interests of most, if not all, stakeholders that are critically impacted to enable them to sustain their business, to receive medication, to receive reimbursement? That's a to be determined. So this is the stuff that's going on. I just wanted to kind of share this with you because I didn't know that this was happening, other than to say this is a prime example of pay attention to organization response to crisis. Why? Because that's a reflection on United Group Health and Change Healthcare's culture. I talk a lot about culture in terms of how it is set up and how it impacts employees. But the culture of an organization, its very soul, the foundation of its value construct, and the relationship it has with its stakeholders. Culture is also reflected in crisis. Culture is exhibited in the way an organization that is impacted by something, for example, of this magnitude. How does it respond? How is it set up to respond? So we're talking about things like risk management, business continuity. Those kind of aspects are direct windows into the soul of an organization's culture. So it'll be fascinating to watch what United Group Health does in the coming weeks to resolve this critically important issue. Did they know with 100% certainty that a malicious organization would come into their clearinghouse system and attack it and infect it and hold it hostage? No, they likely could have planned it out. And so what we're seeing right now play out as we pay attention to the United Group Health and Change Healthcare is a way of looking at how this organization's culture is established so that it can navigate through this and come out on the other end. And the takeaway for you as an executive, as a business owner, as somebody who works in an organization, which you do, that'll likely go through something like this, maybe not of this severity and magnitude of impact, but you'll go through something like this. How is this going to reflect your organization's culture? And what can you do to build an amazingly powerful culture that can respond to this kind of situation? I keep thinking of the Tylenol scare back in the late 1980s in Chicago, when somebody was going into different pharmacies and with a needle and injecting Tylenol containers with poison and the response that was made. That's a classic example of culture built around service and caring and response. So again, my name's Ethan. I am focused on organizational culture. If you like the video, please go down, like it, share it. Be sure to subscribe to my channel and send me some feedback. Drop a comment. Let me know what you think about this and other topics where I am shining a light on organizations, their cultures in terms of the positive aspects of how they treat their people and how they respond to crises, and maybe areas where culture, in an example like this, has a direct bearing and impact on an organization's ability to navigate through chaos and transformation and challenging times. Thank you.